So for introduction, asthma is a chronic respiratory disease that affects the airway of the lung, making it difficult for individuals to breathe properly. It is a common health condition that can occur at any age, though it is particularly prevalent among children and young adults. Asthma symptoms such as wheezing, coughing, chest tightness, and shortness of breath can vary in severity and may worsen during flare-ups. The condition can be triggered by various factors, including allergens, dust, smoke, exercise, cold air, and respiratory infections. Although asthma cannot be completely cured, it can be effectively managed through proper medication, lifestyle adjustment, and avoiding non-trigger, allowing those affected to lead a healthy and active life. Thank you.
Asthma is one of the most common chronic respiratory disease worldwide, affecting both children and adults. It is a long-term condition caused by inflammation and narrowing of the airways, leading to symptoms such as wheezing, shortness of breath, chest tightness, and choking. Asthma develops due to a combination of genetic factors and environmental exposure, including air pollution, allergen, cigarette smoke, and occupational irritant. There are several types of asthma, including allergy asthma, which is triggered by allergens, non-allergy asthma caused by factors such as stress or cold air. Exercise-induced asthma and occupational asthma, which occur due to workplace exposure. Asthma may also begin in childhood or develop later in adulthood. Although medical advancements have improved asthma management, lack of awareness and continuous exposure to triggers remain major challenges.
Asthma is a long-term condition that affects the airways in the lungs and commonly causes symptoms such as wheezing, shortness of breath, chest tightness, and coughing, which may come and go with varying severity. It is a common global health problem affecting around 216 to 300 million people worldwide, and is one of the most common chronic diseases among children, especially when poorly controlled, as it can interfere with daily activities. The condition often begins in childhood but can develop at any age, with boys being more affected during childhood, while women are more commonly affected in adulthood, possibly due to biological and hormonal factors. In terms of distribution, it is more prevalent in urban areas and developed countries, although cases are steadily increasing in developing countries due to urbanization and air pollution. Several factors increase the risk of developing this condition, including a family history of asthma, allergic conditions such as eczema or allergic rhinitis, exposure to air pollution or cigarette smoke, and obesity. Its impact includes missed school or work days and frequent hospital visits, and although asthma-related deaths are relatively low, most are preventable with proper treatment and management.
There are several risk factors associated with asthma. Environmental factors such as air pollution and haze can irritate the airways and increase the risk of asthma. Occupational exposure to dust and chemical fuel is also an important risk factor, especially among factory and construction workers. In addition, exposure to cigarette smoke and common allergens like dust, mites, and pollen can trigger asthma symptoms. Now we will look at an example of an epidemiology study related to asthma. One common example is a case control study on occupational asthma among workers. In this study, individuals who have asthma are selected as cases, while individuals without asthma are chosen as controls. The study then compared their previous exposure to occupational hazards such as dust and chemical fumes. This type of study design is suitable for investigating occupational asthma because it is cost-effective, time-efficient, and can examine multiple exposures. However, case control studies also have limitations such as recall bias and the inability to directly measure disease incidence.
For asthma risk management, the main focus to identify triggers such as dust, smoke, allergens, and air pollution. We also assess high-risk groups like children, smokers, workers exposed to chemicals. Regular monitoring, proper medication, follow-up care, and strong public health measures help reduce the risk and improve control of asthma. For prevention, primary prevention involves avoiding triggers, being smoke-free, and improving indoor quality. Secondary prevention focuses on early detection, screening, and health education. Tertiary prevention ensures correct medication, proper inhaler technique, and following an asthma action plan to prevent severe attacks. In conclusion, asthma is a serious chronic disease, but it can be well controlled with the right strategies. By applying effective risk management, strong prevention, early treatment, and continued awareness, asthma complications can be reduced and individuals are able to live healthy and productive life.